Monica Link, and this is New York City Wired. Back for another episode of New York City Wired. This week we spoke with Northwell Health, and this episode is all about testing and tracing. Take a look.
To date, we've done over 150,000 of the diagnostic PCR type tests for COVID, and we've done up around 200,000 of the antibody tests. We've been partnering predominantly with the governor's office to go around to faith-based institutions, predominantly in communities of color, and traditionally underserved areas in healthcare to make the testing available. And that's still ongoing. We're doing about 5,000 PCR tests a day and a similar amount of antibody tests every day.
Oh, wow. That's really awesome. And so also, I wanted to know, what's the benefit of businesses tapping into the testing that you guys have available right now?
A lot of businesses have approached us both for the antibody testing and for the diagnostic testing. I think for the diagnostic testing, they just want to make sure no one's carrying an asymptomatic infection before they go into the workplace, so they can do the standard precautions and isolations and contact procedures, contact tracing procedures that they want to do to make sure an infection doesn't get out of control in the workplace. With the antibody testing, that will tell people whether or not they've had the illness in the past. A lot of people think that they may have been sick in the past, but they weren't able to get tested for COVID at that time for whatever reason. So the antibody test will tell them if they have it. And we expect that information will come out showing that if you've got the antibodies or you previously had the infection, a proven COVID infection and recovered, that you will have some immunity to the disease, at least for this next year.
Want to know how to get tested? Take a look at the rest of my interview with Dr. Briney, and he's going to let you know. Check it out.
How can people get tested? Where can they find this information if they want to have a test done, if they feel like they've been exposed, or if they've been out of the protest? Where can they go?
So you can go to the New York City government websites. We'll have a listing of all of the testing centers that are set up there. You can go to the New York State government websites, which will also have a list of testing centers that are set up. You can reach out to your usual healthcare provider. Many of them can just order the test, and it's now available out there so that you can get it. You can go to your local urgent care center. Just about all of them are now offering the test to anybody who needs it. So it's getting more and more widely available.
And can you speak to, just really quick, should people be comfortable taking the test, or if you could just tell me a little bit about that too?
Absolutely. There's really no risk at all in taking the test. The antibody test is a simple blood draw, just like any other blood test that you get from your healthcare provider as part of your regular physical checkup or something like that. The PCR test is a swab-based test. There's a couple of ways to do it, but usually it involves putting a swab into your nose to get a sample from your mucosa. It's a little bit uncomfortable. Nobody likes anything in their nose, but there's really no risk of any harm happening by getting that test. And it's quick and it's fast and it's easy, and there's nothing to be afraid of.
New York City's coronavirus cases were previously the highest in the nation, with the highest number of fatalities. Now the city has completely turned itself around and preparing for phase 3. Take a look. New York City has become the epicenter for testing and tracing. This tent was previously used to test coronavirus patients at New York Presbyterian Hospital. Now, with the virus spreading across the United States, other states have looked to New York State and New York City for guidance and advice on how to control the outbreak of the virus. I'm on the Upper West Side, where people are optimistic about phase 2 reopening. People are shopping and going to stores and grabbing outdoor eating. So everything looks pretty calm and almost back to normal, minus the mask in New York City. Today, Governor Cuomo announced that there's a tri-state alliance with New Jersey and Connecticut that anyone traveling from coronavirus hotspots to the tri-state area must quarantine for 14 days or face a $2,000 fine. Take a look.
People coming in from states that have a high infection rate must quarantine for 14 days. And we have a calibration for the infection rate, and any state that goes over that infection rate, that state will be subject to the quarantine. It's only for the simple reason that we worked very hard to get the viral transmission rate down. We don't want to see it go up because a lot of people come into this region and they could literally bring the infection with them.
Thank you for watching. Don't forget to keep social distancing, wear a mask whenever it's not possible, and stay safe. Thank you to all the doctors, nurses, and essential workers who continue to work hard to keep everyone safe and healthy. You can't ever get tired of the street food. They were here during the pandemic, and I gotta say, they are the brave and the dedicated, and they're always here for a good summer meal or some ice cream. I finally got in Trader Joe's. Didn't get a lot, but it doesn't even matter. I'm just glad to get in. Trader Joe's has had about a minimum of 20 people in line every single time I've gone by it. So there was only 4 people in line, and I got food.